A man lost his wife and child because the woman in question here was taught and conditioned not to complain about her health problems. Constant aches around her stomach was a problem. She was battling this issue. She ended up dying because of pre-eclampsia, a dangerous condition in pregnancy. What does this teach us? Have we not really heard about this very, very often? That listening to your body will give you enough clues about your health. And why is that we choose to look the other way? It is often said that when you listen to your body when it whispers, you won't have to listen to it when it screams. Well, if you are ignoring those aches and pains, here's every reason why you should listen. Dr. Pushkar Anand Singh is now with us. Thank you for your time. Doctor, talk to us about the importance of regular health checkups, the importance of catching disease or any problem early on.
So we don't value health till sickness doesn't arrive. So it's very important to have regular checkups so that we can avoid, any kind of complication or any kind of unnecessary suffering that we have to undergo. And most importantly, if you have to nip a disease in the bud, it's important to early diagnose it and to start an early treatment.
Let's face it, one of the least addressed problems is stomachache. Don't we get it all the time? Well, our first thought really is, it could be normal, just acidity or periods around the corner. But this has to be said. Regular stomach aches signal that all is not well. Abdominal pain in women actually could be anything. Very often, it could be brushed under carpet. Women do sit on these problems thinking maybe, it is menstrual pain, for example. We've seen cases of people inviting difficult solutions to a problem, even surgery, because they sat on the problem, isn't it, doctor?
So primarily when a patient comes to us, it's important for us to know that what is the kind of pain that she's experiencing, what's the intensity of the pain, what is the site of the pain, if the pain is radiating, if it is associated with any triggering factor. So these things are important. And once we have a clear history of the patient, there are quite a few common causes for the abdominal pain. So the causes, depending upon her history, we ask them to get investigated. And to answer your last part as to how do we avoid it, the only way to avoid it is to have your regular health checkups and to identify the disease early.
Well, here are the most common overlooked conditions behind stomachache. Gallstones, common in women due to hormonal influences, obesity and dietary factors. Can cause pain in the upper right abdomen, often after fatty meals. Appendicitis, that can mimic menstrual cramps or general stomachache in women, leading to misdiagnosis or delayed treatment. A ruptured appendix is a life-threatening emergency. Doctor, as far as appendicitis is concerned, very often we've seen that it ruptures in patients. Appendix would rupture. Where should actually one expect the pain to occur if that is a problem?
Appendicitis ruptures at a very late stage. The patient usually gets 24 to 48 hours before the appendix ruptures. So the patient starts experiencing pain. Now, once you start experiencing pain, it is important to go to a hospital instead of just taking painkillers and trying to treat it at home. So if the diagnosis is made early, the surgery or the treatment becomes very uncomplicated and simple. But if you prolong it to the extent that the appendix ruptures, then things become bad or it may even become fatal.
The gynecological endometriosis often presents as severe lower abdominal pain and is confused with gastrointestinal issues. It requires careful evaluation and sometimes surgical intervention. Many women ignore bloating or dull pelvic pain, assuming it is related to their cycle. These are large cysts that can twist and require urgent surgery. Doctor, you did mention ovarian cysts, and that also is very common, often seen in women, even in very younger reproductive ages. Talk to us about how common this is becoming nowadays and the kind of pain associated with that issue.
Sneha, ovarian cysts are very common, and there can be various for functional or simple ovarian cyst. We do not really require any treatment. It is just observation, and you should take advice from the gynecologist. However, for complicated cysts like dermoid cyst or for endometrioma, if it is causing significant symptoms, then surgery or prolonged conservative treatment is the way to go.
Women often overlook groin or abdominal bulges, assuming that to be weight gain. Untreated hernias can lead to obstruction or strangulation, both surgical emergencies. Doctor, I also want to ask you, hernia usually perceived as a man's disease, but seen in women as well. A lot of awareness is required regarding that, isn't it?
Groin hernias are common in men. In females, we mostly have incidence of umbilical hernia, that is a
Okay.
small outpouching around the belly button. And we have incisional hernia. Sometimes female undergo multiple surgeries, a couple of LSCS, a couple of more surgeries for some other reason. So in that case, that there's a potential site of weakness that is created in the abdomen, and that leads to outpouching. So yes, hernia is common, but mostly umbilical hernia and incisional hernia are more common in females.
A word of advice from doctors on painkillers and their incessant use. Is the use of painkillers among us Indians. We are suppressing our pain. Of course, using it for relief is something, but taking it constantly day after day is something else altogether. Talk to us about the big problem of unnecessary use of painkillers and then the range of problems that would bring, doctor.
A painkiller is nothing but it is only suppressing the symptom that is
Yes.
pain. It is not taking care of the root cause of the disease. So it's important to understand that painkiller will never resolve the issue. It will only give you symptomatic relief for a short duration of time. And yes, painkillers do come with quite a few side effects. Prolonged use may cause gastritis, nausea, vomiting. Some patients even complain of constipation after taking painkillers. Sometimes prolonged use of painkillers may lead to impaired kidney function. So yes, they do come with side effects.
Here's when you should call the doctor. Severe pain that does not subside with rest. Pain associated with vomiting, fever or bloating. Persistent changes in digestion or bowel habits. Pain that worsens after eating. Pain interfering with daily activities.
If you like the video, do like, comment, share and subscribe.